Welcome, everyone. Thank you so much for joining us today. My name is Louise Ivers. I'm the director of the Harvard Global Health Institute, and I'm delighted to welcome everyone to HGHI's virtual series called Coffee Sessions. This series is designed to explore and discuss the role of partnership and collaboration when working to advance global health equity. We welcome you all to mark your calendars to join us every last Friday of the month for our sessions. This session is being recorded through Zoom, and the recording will be available on the HGHI website and YouTube page in the coming days. We are going to have time at the end of the session for questions for our presenters, so please use the Q&A feature on the bottom of your screen, and we'll do our best to answer those questions towards the latter portion of the event. With that, please allow me to introduce our speakers. I could not be more thrilled and delighted to have these two folks here today. I've learned so much from both of them, and they are truly role models in the global health space. Dr. Anatole Manzi is the Deputy Chief Medical Officer at Partners in Health, where he oversees learning and quality health systems strengthening. He collaborates with PIH-supported countries to develop strategies for quality improvement and integrates quality management with clinical practice through innovative solutions. Prior to these roles, Dr. Manzi trained as a nurse and as a clinical psychologist, and he has previously served as PIH's Director of Clinical Practice and Quality Improvement and Director of Global Learning and Training, where he led education and training strategies, working in clinical domains like maternal and newborn health, infectious diseases, and non-communicable diseases. He has contributed to technical working groups at the WHO and the Rwandan Ministry of Health. His research focuses on developing, adapting, and validating healthcare quality measurement and improvement metrics in resource-limited settings. Dr. Manzi is also an assistant professor at the University of Global Health Equity in Rwanda and a lecturer on medicine at Brigham and Women's Hospital. Dr. Joia Mukherjee is an internist, a pediatrician, public health and infectious diseases specialist. She's an author and a human rights advocate. She serves as the director and advisory dean for the F.W. Peabody Society at Harvard Medical School, and she's been the chief medical officer of Partners in Health since 2000. Her work focuses on preventive and curative healthcare and comprehensive social programs across many countries, including Haiti, Rwanda, and the Navajo Nation. She also serves on the board of directors for Village HealthWorks, MUSO, and the Institute for Justice and Democracy in Haiti, and she advises grassroots organizations globally on delivering healthcare with a human rights-based approach. Dr. Mukherjee also runs the master's degree program in global health delivery at Harvard Medical School, which is for training clinicians and scholars to design, evaluate, and implement high-quality healthcare systems. She's the author of the widely used textbook, An Introduction to Global Health Delivery, Practice, Equity, and Human Rights, which was published in 2021. I want to invite you both to turn on your cameras. And again, I'm absolutely delighted to have you, and I'll pass the microphone to you to get the conversation going.
Great. Thank you so much, Dr. Ivers. It's really a pleasure always to be with you and your group, Dr. Ivers, and of course to be with my dear friend, Dr. Manzi. I'm just going to start the conversation, and I do have my coffee since it's a coffee conversation. And you know, I want to start the conversation about accompaniment, talking a bit about how we met and how Manzi really accompanied me. So Partners in Health was first invited to Rwanda in 2004. I was really fortunate to go for my very first time with our dear late friend, Dr. Paul Farmer. And the government of Rwanda had asked us to replicate the work we had done with our colleagues in Haiti, which was to use the interest and the money and the efforts in HIV to really help to rebuild the health system that at that time, only 10 years after the devastating genocide, was really in shambles. And so we knew how to do this from Haiti, which is really to have primary healthcare be our case finding strategy for HIV, to put together the staff and stuff to make that happen. And so the first thing we had to do after we chose the place we wanted to work, which was one of the most rural places in Rwanda, a very forgotten place, was to hire the staff. And so our dear colleague and friend, Dr. Fernet Leond, who is also just a phenomenal accompagnateur, he put the ad in the paper calling for nurses who wanted to work in social justice and who were able to get themselves to rural Rinkwavu. And that's where I met Manzi in 2005. We worked together over many years on the front lines in health centers, one called Rukira, one called Rinkwavu. And Manzi quickly taught me that what was really lacking in terms of primary health care in Rwanda was a system for supporting and accompanying the nurses. Because most nurses like Manzi had at that time only 1 or 2 years of training. And they were thrown into the front lines of very, very difficult, high volume, complicated care. And so Manzi quickly taught me that over time, everyone needed to have their skills upgraded, that needed to have the ability to do scholarship. Manzi eventually got his PhD in health systems and public health through this amazing work. But in the meantime, really taught me how to accompany nurses on the front lines, how to set up systems where not only were they supervised, which was the standard of the day, or not only did they have a training where they would go to a 5-star hotel and drink tea, but they needed close mentorship, people who were supportive, people who would sit with them and really look at the systems, help them upgrade their clinical skills, but also look at the overall symptoms. How are the charts organized? Do you have enough medicines? And that amazing work, Manzi had the unique ability to codify it. We all know what mentoring looks like. We all know what upgrading systems should look like. But Manzi codified that into what he called the mentoring and enhanced supervision for health, mesh. We use that now as a verb. We are going to meshalize things and do a mesher. And it was really the idea that unless you put long-term mentorship in place, and that is real accompaniment, that is the long-term work to say, how do we upgrade care by sitting together with our colleagues? And so really, I think a lot of the work we had all done in Haiti, which was fantastic mentorship, what I learned from Manzi is there are ways you can get that on paper, study that, innovate on that. And so Manzi has been a phenomenal accompagnateur for me to really understand what nurses need, what frontline providers need, and how to make this almost into a science, but still keep that affective and emotional connection we have to our staff. So I'm just so grateful. Manzi has gone on to run so many training programs right now at UGHE, supported by the Aspen Institute. He was an Aspen New Voices Fellow. Everybody recognizes his brilliance, and I just feel so lucky to have met him when he was just a brand new, young, newly minted nurse, and now to be such close colleagues over 20 years is just such an honor. So Manzi, I'll turn it over to you and hear more about your view of bidirectional accompaniment.
Thank you so much, Joia. What an incredible topic to have today. I think I can't think of any other topic to have in times like this. Actually, I was reading this article by Shan, and I was actually shocked to learn that so many healthcare professionals are leaving the profession still in post-COVID. We saw that during COVID pandemic, and it is still a trend. And we have also, as we speak here, Joia, one or more colleagues who are watching us is feeling overwhelmed.
Yes.
And just like me, 19, 20 years ago, and when you and I met.
Yeah.
And accompaniment is really holding the light for somebody, being a source of hope and positivity, being a guiding light, helping someone find their way through challenges and uncertainty. What you just described is obviously me 20 years ago, but the feeling is the same. So many colleagues may feel a lack or need of accompaniment, and some of us have the accompaniment, but which is unidirectional. As we were thinking about this conversation, we thought accompaniment, the true accompaniment, is both ways, is bidirectional. I just wanted to really clarify this because it's really important to understand what it took to have someone those days who clinically had no experience and no tools and no framework to the level where they become accompagnants as well. But coming back to bidirectionality of this is, that the accompaniment requires a sense of humility. I tell you the truth that 20 years ago, meeting Harvard professors, Joia Mukherjee was with Paul Farmer, and obviously I didn't have access to Google at that time, but all I knew, they were very important people. And my reaction was just keep quiet and listen to what they have to say. But I came to realize that they also needed me to help understand the context, which is really amazing, Joia. When you would always make a way for me and other colleagues to say something, I thought it was another way to say, okay, let me give you a time, but it was an intentional sense of inclusivity and obviously a sense of humility on your behalf. So, and then that's really a critical component. And that brought me to think about the program that we built together. Actually, I remember you saying you giving me all the credit, but we built the program together. And traditionally, we see that the sense, the accompaniment, the traditional accompaniment, like the traditional supervision of health workers, is having someone coming from the top and visiting the clinic or wherever people are, and say, you have to do this and you have to do that. But there's no the other way around. So there's no bidirectional relationship there. And, to your point, what we have noticed is that instead of helping people grow, it was inducing this sense of discouragement and disappointment in the profession. So it is very important to know that the accompaniment is very important. It's elevating people, not only intellectually, but also emotionally. And when we started designing the program, we wanted to see how do we improve systems to allow the providers to provide the quality care, but also having a sense of the accomplishment. Being concrete, the program brought in the tools, the checklists that are needed for them to assess when they are doing the right thing. We also brought in the data in front of in hands of the providers, which is absolutely critical in effective accompaniment. And for the first time, we saw the providers saying, oh, I can use the data and they can present their data to say, oh, this is how I improved the program. So the accompaniment obviously, included boosting the visibility. That's where I remember Joia inviting me to present in different conferences. And then after presenting, she told me, hey, you know what? You can actually submit these as it can be published. I had no idea of what it takes to publish an article. And when I was reviewing my old emails, I came across my first manuscript, which is literally, I sent it to Joia, the first draft, and Joia sent back the version with edits. It's red. Saying, this is not how you do it. This is not how you say it. This is another way you say it. So that's my first article. I think I'm gonna print it out and keep it in my house, or maybe show my students as well. From the first version of my manuscript to something that is really, really presentable, publishable. And since then, how many students did I mentor? Now I can't count the number of those that I mentored in different research. So I wanted to say, let me conclude saying actually what it takes. So accompaniment goes along with that sense of humility and intentional empathy, which remain the drivers of interpersonal connection and global solidarity, like Joia and I. And I think that when I talk about this, obviously there are three things that we need to remember. One, we cannot express that humility and empathy without amplifying the voices of those who are in need. We cannot do that without having an adaptive response and messaging. So knowing your company. And we can't do that without having a dynamic outreach. On multiple occasions, Joia would send me an email, are you okay? Are things going really well? Yeah. So that's what I wanted to say. And thank you for the opportunity for these coffee conversation. I can't think of a better topic in times like this.
Yeah.
Thanks, Joia.
Great. Thanks, Manzi. Yeah, I think that's such an important point, the humility. We both lead teams now for Partners in Health across the world, both Manzi and I. We work very closely with people at many levels, community health workers, nurses, doctors, but also drivers and laboratory technicians and cleaners. And I think for each and every one of them, they have something so important to contribute. I mean, I think all the time of the many, many years that I've spent within Partners in Health sites, and I've never gotten sick. And that's because our cooks are really expert. I've never been in a car accident, even though I'd taken my young child, who is now 18, to so many over hill and dale, because our drivers are very skilled. And so trying to understand that this work of global health is really team-based work, and that to really understand that everybody has a skill. As Manzi said, initially, the skill that I was able to share with Manzi were things like HIV protocols or treating, young children under 5. But at this moment, Manzi teaches me much more about writing articles, having a PhD, and so over time, our relationship also evolves and changes, and we still learn a lot from each other every day. This is a good idea. This is a good idea. I like how you thought about that. And so, I think when we think about accompaniment, sometimes people think it is this, I'm going to take care of this one person. But we really think it is a way of building solidarity, as Manzi said, and of continuously learning from one another, which has been for me the just greatest gift of my life, professional and otherwise, is that I'm just constantly learning from people that I work with. And every year there's a new brilliant mind that joins us in this journey. And, to be open to learning from everyone is such an important part of accompaniment.
Yeah, Joya, I think the other thing is when I think about the power of a friendship, I think, traditionally we think, obviously we are health professionals, we are scientists, what do you think about the power of friendship? Because I can't believe when someone is saying, okay, how long have you been with Partners in Health? I say, okay, 20 years. And say, oh, what made you stay there? And I can't find one word to really say it's that accompaniment, but it's that friendship, an organization that instilled that social justice and equity in me, not just as a lecture, but as a value, and an organization where I find that friendship. What do you say about the power of friendship that accompagnators should express to each other?
That's such a great point. I mean, at the end of the day, like, that is the sustaining force, is love and friendship. I've been thinking a little bit about sort of the social theories that underpin this long-term kind of work. And in many ways, and there is a concept from Black feminism of love politics. And in many ways, I think the politics of love, where you see yourself and the other person, that you see a shared struggle, that you see that you've accomplished things together from a perspective where it's difficult. I mean, that's almost a different thing than accompaniment, because of that strong connection and equity between people. And I think, we know each other's children. We've been there for each other when our, parents are sick. I think it's not really about the work itself. It's about this idea that it is our shared, like, commitment to each other and to the work that's the foundation of a friendship. And so, I think really trying to forge that is just the most special part. And the work is so hard. I mean, look, I'm sure I know you and I have both thought, I can't do this anymore. I'm going to get another job. But it's the people that keep you there, right? It's like, how could I ever leave Manzi? I mean, how could I ever? So it is the shared connection. And I would say same for our patients. There are patients that I love, that I have seen really just thrive and become parts of our team. And that's, another part of friendship, when you can actually work with people who have suffered, the very illnesses that you're trying to, help, and then to see them thrive and become nurses, even doctors, become part of our team, become community health workers. That is just so rewarding, because you see that each person we're fighting for has like an infinite potential. And so I agree with you 100%, Manzi, that the friendship and the emotional connection to one another is a theory of change, right? Is a social theory that can ground us in this work.
I think that I also want to add the power of, since these conversations are also about partnership, the power of partnership and equity, which actually drive our mission. It's, what you just said, Joya, alleviating the suffering. We have, that this bidirectional accompaniment is fueled by the understanding that we are on the same mission to alleviate the suffering. And we find joy when we see what you just said, the patients coming from there and actually start helping other patients. And initially we actually thought accompaniment was just the patient helping other patients or community members helping their colleagues in the community, which was the original, the origin actually of the accompaniment. Then it expanded. We realized accompaniment does no limit to patient accompaniment. It actually goes beyond having also colleagues and teams partner together for equity. And I think this is really powerful.
Yeah, I agree. I agree, Manzi. I'm wondering if you can share, one of the ways you saw the lessons that you learned as a frontline nurse in the work that you do now as trying to build capacity. Like, how do you reflect on that person you were 20 years ago, and what do you bring to this with your empathic skills?
I think you answered the question. I think the empathy part that comes up all the time, every time I interact with someone and they consider me as an accompanitor, I definitely reflect on the first article, Joia. I reflect on that when I see my students, when I see my team, and when I know, I can imagine how far they are and they gonna go. And I think I reflect on myself, and that is really helpful. And I go back in my toolkit that I got from you and so many other colleagues, and I say, this is the active listening needed right now. Nothing else is needed in times like this. For this colleague I am helping or I'm working with, what I need right now is just active listening.
Yeah.
That's the same as someone express or continue to express. So, and, I get into that toolkit, again, back to your question, I the accompaniment that I received and I continue to receive helps me when I interact with my colleagues by listening, by being present. The genuine presence is really critical. It's very important. Be present. They can see I am here. Some of my colleagues may find it a little bit. Someone told me, "Hey, I thought I was taking all your time to ask you for this." And I say, it's not my time, it's your time. So I think that is really key, obviously, because someone did that, right? And that actually informed me, became part of my toolkit. So the accompaniment that I was provided with is informing the accompaniment that I provide to my colleagues. But again, I see my colleagues also, providing that support to me when I feel down and I feel like I can't move any longer. That's exactly what they do. I think it's a journey that requires that genuine presence, that humility, but really bringing the tools. I like active listening. And obviously, I am vocal when it comes to amplifying the voices of my colleagues, because for someone to be there, you need to raise them. And just like I need someone to say, I think it's important to listen to him. So I think that accompaniment really continues to inform what I do. It's a journey. I did not say that we are already there, but accompaniment is a journey, and a journey that is enjoyable when we keep our lights up. And, when we know that someone needs our light, we keep it up. And that is really important, and I feel so proud to hold that light for somebody.
Yeah, that's a great. I like that you started with light and ended with light. That makes me happy.
Yeah. Thanks
Uh,
for holding the light for me, Joia.
And same, back at
Yeah.
you.
And yeah, I know we probably we don't want to start again the conversation, but of those many we met with Louise Ivers, thank you.
Yeah.
I'm jumping back in here. We have a lot of thanks in the chat and a lot of questions, and I just feel like this is such a rich, this is like a really rich and profound conversation, which is not a surprise to me because I know you both, and I'm just so in so much of admiration. And Joia, I think that Manzi is just one of the many people who you are in accompaniment with around the world. Like that's immeasurable amount of impact that you've had. And I just really like how you've been describing so much of this, like seeing the infinite potential in all people. And I'm really struck by the conversation about the friendship and the emotional part. And I wanted to ask a question about that. And I'll bring in some of the questions from the audience. I think that this profound partnership and accompaniment is really when we move from these transactional global health relationships, which happen so much in academics, especially, it's transactional, it's a project, it's a grant, it's a contract, into the more profound, as you've described, friendship, emotion. And that is hard too, because you also have to break down your own barriers. You can't compartmentalize as much, and someone has asked about that. Can you say more about that? You've talked about, the work is hard, but it's the people. Does that resonate with you? Deepening into this relationship? And maybe the question is, how do we teach that to people? How do you teach that to people? Especially those who are interested in quote unquote global health, because it requires a jump and a leap and a willingness to be heard, maybe, or to be vulnerable about that. Does that resonate?
Yeah. Manzi, you want to take that first?
No, you can go first, Joy.
Okay. Yeah, I mean, it's a great question, Louise. Thank you. I would say that I absolutely think it's teachable. But to teach this kind of bidirectionality, one is obviously role modeling, just making sure that everybody is treated with dignity, that, whether it's a cook or a driver or a frontline nurse or a colleague who, went to a medical school not as famous as yours, to understand that we learn stuff from everybody and to really model that. That's a really powerful thing. We're also working, and Manzi's been part of this, on the social medicine competencies, because there are now increasingly we're held to account on equity, health equity, and there is no health equity if you don't listen to the voices of others, right? And really appreciate when someone needs something. And I remember, for example, talking to Manzi probably 18 years ago, and he was explaining to me something very profound that I didn't understand at the time. And it was a simple thing. It was really about the educational system in Rwanda, and how at the time there was not a bachelor's degree, or an A0, it was called, in nursing. So he was going to pursue psychology so he could get that next level. And I could have said, "Oh, you're fine as a nurse. What are you talking about? But you don't want to." But I listened to him, and it also helped me really understand the educational system, so that when it came time for Manzi then to pursue a master's degree and to pursue a PhD, I had already tried to understand his aspirations. Like, too often we're focused on just the work without understanding what is it that this person wants to accomplish for their lives. And often it's education, whether it's a community health worker. I'm working with one of our amazing community health workers now to write a paper. And she explained to me, I want a master's degree. She doesn't yet have her bachelor's, but we're going to work on that. That's her goal. And so understanding that everybody has aspirations, and that the only way to really appreciate that is to do active listening, but also to see, how people are wanting to use their skills in their own life. So, I feel like when you come through any Western system, right, you have every opportunity at a certain level, right? You're going to do this training and that training. And far be it from me, who did, a double residency, a fellowship, a master's degree, to say, no, 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 you shouldn't want that bachelor's degree in psychology. Like, who am I to say that? That's crazy. So I think that is a way that we decolonize our minds, is to really say that people all have aspirations to better themselves. And if we're in a position of privilege and can help open those doors, that we must.
I think you covered it all. Yeah.
Let me
No, definitely. I like when you say listening. Definitely, absolutely. What I want to add is also listening to sometimes those voices they're not loud enough, right? So some voices are not loud. And what I mean is understanding the content, where they come from, their background. Sometimes we only listen to what people say, but what is their family? What are they going through? And what are they facing? So sometimes the mentees, let's say the one you are accompanying, or when you are being accompanied, not knowing the context is a missed opportunity, because we are not alone. We come with our families, with our
Yes.
background, with
Yes.
our community hardships. So
Yes.
when we
Yes.
understand that, it really brings our accompaniment there. And that's really what working with the Joia and our led Paul Farmer and others, and working with you, Louise, that that is what really makes a difference. Being able to listen beyond the expressed concerns and understanding the real background is key. And these can be taught. I think in many cases what we do is, we use case scenarios. We use role plays. And when I launched the mentorship program in many years ago, that like Joy expressed, we would actually have these role plays. And after that, you say, "Oh, I noticed that you are. This is how you are communicating with the patient," and someone will be surprised. Really? So it's really important to figure out not just the didactic training, which we try to stay away, but how do we model best practices using so many other ways? Now that even with the emerging AI technology, we can easily, think about the interaction between two people. It could be patient and clinician, but it could be also colleagues, and really being able to model best practices. Most importantly, being able to being genuine is key, and being able to say, "I am here to learn too," showing that by directionality. That opens the door, especially you discover someone's internal room and they open up, and then the accompaniment becomes magic.
Yeah. Magic.
Magic. Okay, the magic takes time to complete. And so again, we have loads of questions, but one is about like how should we advocate around making sure we get that time from different systems? I mean, whether it's in civil society, NGOs, or academics, like this, to do this work well, like you need time. And the more you go fast, the less accompaniment, I would say it is, are there things we can advocate more, or what are your thoughts on generating that time and those resources for the partnership part?
You go first, Manzi. I went first last time. Your turn.
That's what you do all the time. Thank you. Um, the time is really important, but also the time becomes the excuse oftentimes. So I am always careful when I say I don't have time, because many times people say, "Oh, I have no time to be a good accompanitor, to be a good mentor." So we make a time. And that's what we have seen at Partners in Health. We continue to see it's been over 40 years. We make a time for those vulnerable individual patients, but we also make time for colleagues, just like we do for our students. I think making a time is really important, but it is also challenging. I think it is challenging. It's important to know that it's challenging. If I was to, if I was to suggest we have a 20, maybe 29, 30 hours in one day, that will be it's an impossible wish. But what I have seen is, I think, the ability for institution to also allow accompagnators a time. I think there's a lot that could be done. So, you know, being able for institution to say, you have a time for you to check in, make a time to check in, having that on the calendar. What we do, and Joia and I are we often on some of the same research committees for the students. We try to protect the time on the calendar, because a time that's not protected is then there's no time. So we use some of those tools, but I think institutions, especially academic institutions, could do much better in securing time for the faculty to be available to students. Hospitals and other organizations should really save a certain percentage for people to be accompagnants. And accompaniment is sometimes not structured. Yeah. I needed time to be available for someone who needs me. And if I am fully booked, there's no wiggle room. So then that's where we say, I have no time to listen. So I think it would be really good to have individual commitment, but organizations can do more to secure a time for people to be accompagnators in a structured or unstructured way.
Yeah, thank you, Manzi. I mean, I think you are so pragmatic about that, and I'm always marveling at that. You have time for everyone. I will take the other side of Louise's question about the longitudinal commitment over years, which I think, you are correct. I think what is unsaid in your question, Louise, is that often these things are very punctuated. You have an exit strategy, you have this. And I feel like incredibly lucky to work for an organization that just makes a long-term commitment, period. But I also know that for many of you, from different organizations, different academic spaces, you still have made a long-term commitment to a place by continuing to seek grants and projects with those people that you're working with, to continue to put them in roles. And I'm thinking for a minute about, our wonderful colleagues at Gescu in Haiti, who are mostly a research organization, but they've made a deep commitment to place. They've made a deep commitment to their team, to elevating the voices of those Haitian researchers and colleagues, and doing training. And so I think there are ways with longitudinal, even if it's punctuated, to be mindful of the longitudinal relationships we make, and then how do we give people the opportunity. Again, I think, to me, teaching people, Americans, Europeans, to not assume that we are privileged because we're better, but rather we're privileged because we've had those privileges, and it is our job to create platforms for people to advance and move forward in whatever way they want, and not for us to decide, well, I want you to do this, or I have students often that say, I'm sorry, but I really don't want to go back, to my home country. I want to do residency. I'm like, good on you. Let's do it. I don't have the luck on what the appropriate use of your life and your time and your aspirations are. And so I think making a long-term commitment and supporting your colleagues in whatever way to achieve their goals, not yours, I think is the way that everyone can practice long-term accompaniment.
Thank you both so much. We're actually coming to the end of the time, which is hard to believe, but there's so many questions that show how much people want to hear more about this topic. I'm going to ask you each to just give kind of a 30 seconds closing comment, but one of the questions that came in was about how, we often think of kind of service as hard, exhausting, burdensome, but it can also be energizing and soul nourishing. And so I think a nice question to kind of end on is how the accompaniment spirit is energizing or fulfilling for you. And if you can each comment on that, or anything last you want to say just before we close out the session.
Yeah, I would say it is absolutely love of people, this shared struggle that becomes fun. And so I think a lot of it is to not look at it. People always say, do you have work-life balance? I say, when you have a vocation, it's fun. Like, this is what you do. My friends are the people I work with. My friends are the people I get to see. Not to say I don't have other friends as well, but it's a fun thing to be engaged in work of solidarity with people. You laugh, you take care of each other. And I think if you see people fully as human and fully as equals and fully, then it lightens the load, because it's not all on you as a savior. I think the savior thing is very heavy. And so it's better for everyone to look at this as a team sport.
Manzi, closing words?
Yeah, I also want to echo that, saying that really accompaniment is what we need to elevate those colleagues, and accompaniment is the real definition of a true partnership. A partnership that which means something else is not a lasting partnership. And I think that the partnership, this accompaniment has to be bidirectional. And anything else is not accompaniment. So we have seen the remarkable impact that we've made as an organization, Partners in Health. The secret was accompaniment and remains accompaniment. We can actually elevate our companies, our mentors, our mentees, and our communities if we really could apply and explore and apply these concepts. So I think it's been a great honor to be here. So thank you.
Yeah, thank you for having us.
Thank you both so much. Thanks to everybody who joined online. I do want to offer that Dr. Mukherjee's book, An Introduction to Global Health Delivery, Practice Equity, Human Rights, has many of these concepts and is a really great teaching tool. So for those, because we've had many questions about how to teach that and how to teach this. So please look out. You can also see Dr. Manzi has given a lot of very inspiring talks online as an Aspen Fellow and others. So please, you can learn more for them. Thanks, everybody. Really appreciate it. Have a great day.
Thank you.